Examination. A meticulous examination is the key to the early diagnosis of CDH. There may be limitations of hip abduction, asymmetry of groin, creases, or an audible click. Uh, there are the follows some tests. First is test. The test has two parts. In the first part, the surgeon faces the child's perineum. He grasps the upper part of each thigh with his fingers behind on the greater trochanter and thumb in front. The child's knees are fully flexed and the hips flexed to a right angle. The hip is now gently abducted. As this is being done, gentle pressure is exerted by the examining hand in a proximal direction while the thumb tries to push out of the hip. As the femoral head rolls over the posterior lip of the acetabulum, it may, if dislocatable but not if dislocated, slip out of the acetabulum. One feels an abnormal posterior. This is the Barlow's test. We can see in this image how the therapist hand are placed on the greater trochanter. A movement appreciated by the fingers behind the greater trochanter. There may be a distinct clunk. If nothing happens, the hip may be normal or may already be dislocatable. In the later to second part of test would be more relevant. In the second part of the test, with the hips in 90-degree flexion and fully adducted held as described above, thighs are gently abducted. The examiner's hand tries to pull the hips while the fingers on the greater trochanter exert pressure in a forward direction as if one is trying to put back a dislocated hip. If the hip is dislocated either because of the first part of the test or if it was dislocated to start with, a clunk will be heard and felt, indicating a reduction of the dislocated hip. If nothing happens, the hip may be normal or it is an irreducible dislocation. In the latter case, there will be limitation of hip abduction. In a normal hip, it is possible to abduct the hips till the knee touches the couch. The next one test is Ortolani's test. This test is similar to the second part of the Barlow's test. The hips, knees are held in flexed position and gradually abducted. A click of entrance will be felt as the femoral head slips into the acetabulum from the position of dislocation. In older child, the following findings may be present: limitation of abduction of the hip, asymmetrical thighs fold, higher buttocks fold on the affected side, Galge's sign, Ortolani's test, Trendelberg's test is positive.